views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Hello and welcome to OpenBxRx, BronxNet special coverage providing you the latest information that matters to you during COVID-19, the coronavirus, and now through civil unrest and social justice actions taking place nationwide and here in the Bronx. I'm your host, Sonyi Lopez, and today is Tuesday, July 21st. Coming up, we'll speak with United Way of Central Indiana about their upcoming Understanding Roots of Racism virtual series, breaking down how policies behind health, housing, food, and transportation have affected people of color. Then, drive-in movies are making a comeback. Find out about the Tribeca drive-in experience at Orchard Beach here in the Bronx. After that, we'll learn how Rain Inc. continues to provide home health care and resources and support to seniors, children, and caregivers during the pandemic. And the Bronx brand joins us to discuss how they've been highlighting and showcasing the Bronx while supporting creatives for the past 5 years. So please stay tuned. OpenBxRx starts now. Welcome to OpenBxRx on BronxNet. I'm your host, Sonyi Lopez, inviting you to get social with us at BronxNet TV on Instagram and Twitter, and BronxNet Community Television on Facebook. To better understand the history of racial injustice and how it affects communities of color today, United Way of Central Indiana is hosting a 4-part series of virtual discussions titled Understanding the Roots of Racism. Joining us now to discuss is CEO of United Way of Central Indiana, Ann Murtlow. Ann, thank you so much for joining us today.
Thank you for having me, Sonyi. So nice to be with you.
Nice being with you as well. Thank you. So first to start off, Ann, for people who are not familiar, can you tell us a little bit about UWCI and your mission?
Sure. Well, our mission is to make Central Indiana a place where we're proud of the quality of life for all of our residents. And we know we've got a long way to go. We cover 6 counties, and we have the richest county in the state and some of the greatest poverty in the state, everything from urban poverty to rural poverty to suburban poverty. We know from our research that we have in our poverty and struggling families, which is families living up to 200% of the poverty level, those families are disproportionately represented by families of color.
Right. So, Ann, we're miles away from each other. BronxNet is based in the Bronx, and I know UWCI is part of United Way Worldwide, and there's a branch here in New York as well. But I reached out to United Way Central Indiana to promote your upcoming event. And the fortunate aspect of the virtual world we live in today is that we get to connect and attend events no matter where we are. So with that being said, Ann, please tell us more about UWCI's upcoming Understanding Roots of Racism virtual series and how this event is not only for Indiana, but also relevant for cities nationwide, like here in the Bronx.
One of the ways that United Way stabilizes families is to focus on basic needs. And when we talk about basic needs, we're really talking about hunger, housing, transportation, and health, because those are things that people need to be able, they need to have those before they can really even focus on growth and really building their economic stability to a greater level, right? Their financial stability to a greater level. So when we decided to do the Roots of Racism series, we decided to focus on those 4 areas, and that's why it's a 4-part series. So what we wanted to do was we wanted to say to members of the public in our area, let's first understand how we got to where we are. And so we're taking each of those 4 areas and we're saying, let's talk about health first. So that's the one that's coming up on Wednesday. And we're saying, let's look at health in our area and look at the health disparities. And how did we get here over history? The policies and procedures and practices that were put in place over decades that led us to a place where we have all these disparities in health outcomes. And it's not just about COVID, but certainly COVID has spread really shined a bright light on the fact that we have health disparities, right? But there are historical facts that are involved, right? There are historical facts that um, that have resulted in a lack of trust in the healthcare system, that have resulted in food deserts and food insecurity, and poor nutrition, and all kinds of things that have led over time to really disparate health incomes. And it's very complicated, but until you can understand exactly why you ended up here and what the situation on the ground is, you really can't understand, number one, how not to repeat the mistakes of the past, and really understand where you are so you know how you have to get to a better place going forward. And then for our donors and other members in the community that want to work together to make things better, we really want to be able to put our arms around the community and say, let's work together, and let's see how we can do that with advocating, giving, and volunteering to really make this a place where we're proud of the quality of life for all of our residents going forward.
I love that. Thank you so much for sharing, Anne. As we know, some of us know, Indianapolis state and local governments are among 20 other cities and counties who have declared racism as a public health crisis. How have things changed in your city after this action?
Well, I would like to say that we're having a lot more conversation, and I think that's really true. We're having a lot more conversation at every level: government organizations, corporate organizations, nonprofit organizations. And I think that there's a greater sense of urgency than there was before. That's not to say that there wasn't a lot going on before, but there certainly is a greater sense of urgency than there was before. I do think that there has been a greater awakening, if you will, when it comes to police violence. Mm-hmm. And, we can certainly have an argument over whether or not that's reasonable that it took so long for that to happen. I certainly think that the fact that it was so visible on social media, in so many cases from so many places in rapid succession, made a big difference in this case. And I think whatever it was that made it happen this time, there are many more people who are saying this is a priority, and it is getting attention. I still don't think it's a quick fix, but I do think that it's going to take time, and there are enough people in enough places that are working on it that have the ability to change things, that I'm hopeful.
Right. Going back to UWCI's commitment to supporting and hearing the community amid protests, civil unrest, and demonstrations, can you just tell us a little bit more about it?
Well, we have not only the ability to do work through community investment, but we also do have public policy capabilities and advocacy capabilities. So, we do things like, we're a human services organization. So, we do things like advocate for education. One of our big activities has been over the last few years to really advocate for quality early childhood education, pre-K. Indiana is one of a handful of states that does not have pre-K for all families, state-sponsored pre-K for all families, high-quality pre-K. In fact, only a small percentage of our low-income families even have access to high-quality pre-K. And so it's something that we've been building capacity for and advocating that the state actually pay for. And we've been doing a good job on that, but we still have a long way to go. That is something absolutely critical to the success of our children long-term. And we're going to continue to do that. While advocating for police reform is probably not something we will ever lead on, because we're not in the best position to be successful in leading on. There are other organizations like the Urban League, for example, that would be better positioned to lead on that. That is something that we would be positioned to support on. And that's something that we would be prepared to do.
Thank you, Anne. Going back to the Understanding Roots of Racism event, what does UWCI hope people can gain from participating in these important discussions?
Well, again, I think it's important for folks to understand. I think that there are a lot of people who, number one, may never have known the historical perspective, or if they did know, have forgotten some of those policies, procedures, the experimentation on Black communities and Puerto Rican communities from the past that led to some deep mistrust in the medical system. If we talk about that first session on health, redlining when we talk about housing, those kinds of policies that will help to understand how we got to sort of the neighborhoods that we have right now that have pockets of deep poverty, that are predominantly Black and brown neighborhoods, neighborhoods, frankly, that a lot of people don't see every day. And neighborhoods that we really do need to shine a bright light on, because the fact is that there are two worlds right now. There are worlds many of us don't live in every day, and neighborhoods that it is too easy not to see. I think we do need to see them, because we can't know what we don't see. And we have to see them in order to be able to help.
Right. And what will the virtual series look like? You know, you have panelists, but will there be opportunity for Q&As? How would it work out?
What we're going to do, there won't be opportunity for Q&A. They're going to be moderated. So this first one is going to have 4 experts, local experts. So we'll have Marion County is where Indianapolis sits. So the director of the Marion County Health Department is Dr. Virginia Kane. She will be a panelist. We will have Carl Ellison, who is the Minority Health Coalition CEO. We will have Dr. Ram Yaletti, who is the Physicians Executive for Community Health Network, one of our hospital systems, who is a cardiologist and also one of the foremost experts in the treatment of COVID-19 as well. And then we have one other panelist, and let me come back to that because I'm gonna remember who that is Senator Jean Breaux. Who's one of our legislators, right? And then it's going to be moderated by United Way of Central Indiana's VP of Community Impact Data and Analytics. So she does all of our poverty research and analytics. So it's going to be a wonderful panel. It's only an hour long. It's all virtual. We have about 1,600 people signed up for it already. And then we will follow up with additional resources so that people will be able to learn more.
Right.
And then encourage them also to join the series, because people will also find out that these are not silos.
Yeah.
They are deeply interconnected. So if you followed any of the work on social determinants of health, for example, you find out that these are all connected.
Right. And this show is going to be airing after the first series starts. So folks will probably not have the opportunity to learn about it prior. People that live here in the Bronx anyway. But we will still be promoting the other 3 series. Let's say someone can't tune in for the first one. Will there be a re-airing on UWCI's page? How can people tune in after?
I do believe they will be recorded. So I think there will be an opportunity to be able to hear a recorded session of all 4 of the sessions.
Alrighty, thank you so much for your time today. And just to finish off, how can people stay connected and also tune in to this event?
UWCI.org, all the information will be right on that. And if you just search for UWCI.org Roots of Racism, you can find all of the information right there. Thank you so much for your interest in this. I know this is about Central Indiana, but this information is really relevant to any community.
It is. It is. You brought up redlining, you brought up transportation, housing. These are all things that we are also, all social determinants that we are also really worried about here in the Bronx. A lot of inequities happening here in our borough as well. And there are discussions surrounding this, but I believe understanding the roots of racism kind of compiled everything together. And this is something that we're definitely interested in learning more about, even if it's miles away.
Absolutely. Absolutely.
Thank you, Anne. Folks, again, for more information and to join United Way of Central Indiana's virtual series, Understanding the Roots of Racism, visit their website, uwci.org, and click register today. OpenBxRx will be right back.
Bronx Borough President Ruben Diaz Jr., alongside local and health officials, visited the Bronx pop-up hyper-local testing site to speak to constituents in the Tremont section of the Bronx.
And now is the time for you to come up and commit yourself to your end of the bargain, which is to get yourself tested. This way you know your status, you know whether you need to stay home, you know how to protect your loved ones, and then the city can also track and trace you and see who else you may have been in contact.
We did very badly a few months ago. We are in a good place right now, but we cannot take our eye off the ball.
NYC.gov say low-income communities like East Tremont in the Bronx were hit the hardest by COVID-19 and reported the highest positive cases. Senator Gustavo Rivera expressed hopefulness for the future of communities in the Bronx, which are showing a continuous decline in hospitalization and death rates. He also took the opportunity to address some of his concerns.
This is a zip code right here, one of the zip codes in my district, 10457, which had high incidences of positive tests, but had low rate of testing. We want to make sure that we can fix that.
That high hit rate, if you will, indicates that we need to test more people. We need to make it as easy as possible for people to get tested. We need to have that test result be turned around quickly.
Health officials say their goal is to test 2,500 people in a 2-week period in the Tremont area. To find a testing site near you, visit www.ny.gov. Reporting for BronxNet, Ashley Tiffany.
Welcome back to OpenBxRx. As movie theaters continue to be closed, drive-in theaters are becoming a more popular, safe alternative for those seeking to get out of their homes for an evening. Here in the Bronx, Tribeca Drive-In Theater has set up at Orchard Beach. Joining us now to discuss is Cara Cusumano, Festival Director of the Tribeca Film Festival. Cara, thank you so much for joining us today.
Thanks for having me.
Torres, just to start off, can you tell us a little bit about Tribeca Enterprises and the Tribeca Drive-In Theater here in the Bronx at Orchard Beach and throughout the city?
Yes, definitely. So we run the Tribeca Film Festival, which was not able to happen this April. So we have had outdoor screenings and the Tribeca Drive-In as an outdoor event that's part of the film festival since our very first year 20 years ago. So we felt like there was this really unique opportunity to continue to bring people together around movies and remind everybody about that amazing big screen experience that we can't have in theaters for the moment, but we can have in this different way. And so the drive-in was kind of born from that, and we wanted to do it in a big way, definitely in New York. So we're here in Orchard Beach and we're at Nickerson Beach, and we're also nationwide. So really trying to kind of bring that love of movie magic and start to have a community around film again in this moment.
I love that. Thank you for bringing it to the Bronx. I'm definitely going to participate. I haven't been to the movies as all of us in so long. So I saw some of the screening listings, some of the show times, and I'm super excited to see that you're having this here in the Bronx. So thank you. I wanted to learn how Tribeca Enterprises is supporting the Black Lives Matter movements and essential workers during COVID-19 through this driving experience. Can you share more about that, Cara?
Yes, so the Orchard Beach screenings are free. Some of the screenings have a paid admission, and we're donating a portion of that to the NAACP Legal Defense Fund. And we're also reserving spaces at all of our screenings at all of our venues for essential workers. So it felt really important with everything that's going on that we be creating space to thank the people doing essential work at this time and make sure that they are included and honored in this experience.
I love that. That's an amazing initiative. Thank you. I also wanted to learn how Tribeca is ensuring that attendees are kept socially distanced and safe while participating in these drive-in theaters.
Yes, we've been very attentive to that. The whole idea is that this is a socially distanced film-going experience. So we've been following all of the guidelines, and then some. We're working with the city and the state. The ticketing is entirely contactless. We ask people to stay in their cars for the duration of the event. You can leave to get some concessions or to use the bathroom, but we ask for masks and socially distanced guidelines to be followed during those times. All the cars are parked 6 feet apart, and everything, restrooms, etc., undergo a really thorough cleaning before, during, and after. So we've been incredibly attentive to all of the ways that we can keep it super safe and be super mindful of all the requirements.
Good to know. So folks, if you're viewing this now, just, be sure that it's safe to go to these drive-in experiences. And, you also have to do your part of being safe as well and keeping socially distanced from each other. Also, I wanted to learn, Cara, about the upcoming Walmart drive-in experiences. That's something else that's coming up from the Tribeca Enterprises as well.
Yes, so we'll be continuing our drive-ins throughout the summer and into the fall in partnership with Walmart. They were really excited about what we were doing and have offered 160 Walmart locations to become pop-up drive-ins. So those will be across the country, free events, the same kinds of programming that we've been doing of kind of amazing big screen experience films for people to be reminded of that movie magic for a minute.
Yes. And what are your hopes for communities in the Bronx and other locations participating in the Tribeca Drive-In experience?
I hope it's fun. I hope that it's a little bit of a return to what we miss about going to the movies, about being together. We have comedies, we have action movies. We tried to keep it really fun and really celebrate the films that we love the most from the past 100 years, the history of film. So there's some really great stuff coming up this week. We have some superhero movies. We have Dark Knight and Wonder Woman. The weekend after that, we've got some great comedies with Meet the Parents, Pee-wee's Big Adventure, Girls Trip, and then the last weekend, the first weekend in August, some fun action films. John Wick will be screening, and James Bond, and what was the last? Oh, The Fast and the Furious. So we tried to keep it really really fun and give people that experience of going to the movies while we wait to go back to theaters, because it'll be back soon.
Right. And I just love the nostalgic aspect of being in a drive-in theater. Like, it's something that we don't really see often in the city. So I really love that that's the way Tribeca Film Festival is doing it. I wanted to also ask, just for those viewing, how people can get tickets and see showtime, stay in touch, all that good stuff.
Yes, so all the information about screenings is on our website at tribecafilm.com. The Orchard Beach screenings in particular are all free with a ticket, so you just have to go online and reserve your parking spot, and that'll be through the weekend of August 2nd. So the next 3 weekends will be in New York, and we also have locations in Los Angeles and Dallas.
Wow. Thank you so much, Cara, for your time and for sharing more about this drive-in experience.
Thank you so much. See you there.
Of course, I'll be there. So for tickets, showtimes, and more, again, you can visit tribecafilm.com. OpenBxRx will be right back.
Who's most at risk for coronavirus? People over 65, people with underlying medical conditions like heart disease, chronic lung disease, asthma, diabetes, people undergoing cancer treatment, and people with weakened immune systems. What should you do if you or a loved one is at higher risk? Avoid close contact with people, avoid crowds, stay home if you can, wash your hands frequently. Learn more ways to protect yourself and others at coronavirus.gov.
Welcome back to OpenBxRx. Regional Aid for Interim Needs, or RAIN Inc., has been providing home health care resources and support for seniors and caregivers throughout the COVID-19 pandemic. Joining us now to share more is Dr. Anderson Torres, President and CEO of RAIN Inc. Dr. Torres, thank you so much for coming back on the show. We had you earlier on in the pandemic.
Well, thank you, Ms. Lopez. Thank you for allowing me to represent RAIN at BronxNet. It's how should I say, it's a great experience to be back on the show, as we have improved greatly with the COVID-19 experience in New York City.
And we want to learn about that. So can we just talk about Rain Home Healthcare and your mission as well, just for those tuning in that may not be familiar?
Sure. So for many of you that are tuning in, RAIN is a not-for-profit organization that was established in 1964 to provide interim needs to those individuals that are in need. For example, back in the days, people that were discharged from Westchester Square Hospital and didn't have any resources, the founder at the time was providing those types of support services in the community, even if it was for a brief period of time, because it was felt that people needed that extra assistance at home as they were recuperating from their condition. And we've continued with that mission. The home healthcare program within the organization not only serves seniors, we also serve children. So it's from children to young adults, middle-aged to older adults. And the diagnosis from the children may consist of autism, developmental challenges. With the young adults, it could also continue to be cognitive challenges and individuals that are also recuperating from accidents and other brief conditions. So, you know, we have different types of services for the different needs of the individuals that are trying to secure those services for home health aid.
And how has RAIN been ensuring that home health aides and clients are kept safe during COVID-19?
Wow, that's a great question, Ms. Lopez. You're taking me back to the height of the pandemic. We, like many healthcare institutions, had been challenged with securing PPE to make sure that our staff were protected and continue to be protected. We actually updated our website and we took a picture of people in their full PPE gear. But, you know, we were ensuring the protocols that were handed down by our governor's office and also our funding sources as well. So we had to restructure the way we provide services. Example, individuals that were reporting symptomatology, we were going also into self-quarantining, even with our own staff, making sure that, you know, they were accessing testing as appropriate. We ordered gloves, we ordered masks, we ordered face shields, we ordered gowns, you know, gloves, everything that you can, you know, imagine in terms of trying to keep an individual safe, not only for the home care worker, but also for the client at home. And so they were with very complex needs. We had situations like many in the industry had, where the patient or the client had concerns with someone coming into their home. And so some of them wanted to suspend services because they didn't want to be put at risk. They were saying, we don't know where the home health aide or the worker was, you know, taking the bus, taking the train, being around people that, you know, maybe with the illness. So there was a lot that we had to adjust to during this pandemic, but we were always able to provide a service. Unfortunately, we had clients that died as a result of COVID-19, not only on the home care side, but also members from our senior centers as well. And we also had staff that died as well. So it was a mixture. There was a lot of loss, and there continues to be concerns with loss as well. And, you know, we try to hang in there in terms of, you know, giving people the support that they need, validating their concerns, their fears, also celebrating accomplishments and the perseverance of those individuals that still wanted to make an impact in the lives of those clients and for the clients that allowed us into their homes as well.
Wow. Thank you, Dr. Torres, for sharing that. My condolences to the RAIN Inc. Team for the losses of some of your employees as well as your clients as well during this pandemic. It has been a very tumultuous time, and it's very, very complicated to explore the depth of caregiving as well as those who receive the services who unfortunately have also passed from COVID-19. So I just wanted to explore some of the services that are provided by RAIN Home Healthcare and how people can get those services, as well as anyone who's tuning in who wants to inquire about a position or possibly be working with RAIN as well.
Sure. Let me share a screen with you so that you could see a little bit or capture a little bit about, what we're able to provide. But Rain, as you see, we look at the social determinants of health, and then all these different types of services are really a part of the portfolio that the organization provides. Very popular, the senior centers, and our senior centers actually remain closed, but one of our senior centers just converted into a COVID-19 testing site.
Oh, wow. Which one is that one, Dr. Torres?
2424 Boston Road. And I can send you afterwards a press release to that. And it's all free. And it's in partnership with Health and Hospitals Corporation as well. NYCHA is involved and other entities. But it's a whole public campaign from New York City to make sure that testing is provided to those members in the community. So that's the Rain Boston Road Senior Center site is now a COVID testing site. We continue, providing housing and reviewing applications for those individuals that are in need. There's a number here at the bottom left-hand corner, and that's part of the Rain One-Stop Services. They continue to function and receive calls, and that's at 718-239-4358 to help connect people to services. We're also shifting our annual walk for the Alzheimer's Caregiver Link program. And so now, instead of all of us going to Orchard Beach at the same time, we're going to encourage people to do their walk virtually wherever they are at, with close family and friends, and observing the social distance and wearing a mask accordingly to follow the protocols. And so that's a big change in terms of how we provide that service. When people come here for employment, and we do have several positions, not only home health aide, but others, and we're updating that on our website today, but they can call 718-892-5520, extension 171, and that is connecting to the Director of Human Resources, Ms. Lorraine Sullivan. Again, 718-892-5520. For those home health aides that are interested in employment with us, bilingual is especially helpful, not only in Spanish, but also in Russian, and also different African languages as well, like Edu, Fulani, and etc., because we have a very diverse patient base. And so that's very important to consider when you're applying. If you have a special skill that you would like to share with us, that would be greatly appreciated. You must have your certificate of completion for the home health aide course, having passed that course, your social security card, 2 references, and it's not that complicated. You will be engaged in a background check, as many agencies are engaged in that, and then we assign you to a case. We have cases that are split shift cases and so forth, 7-day cases. And so we assign different shifts to the different clients in their homes. We continue to provide meals as well.
Dr. Torres, I'm sorry. Can we take off the share screen so we can see your face now?
Oh my goodness. Hold up.
Wants to see your face.
I think the circle was much better, but you're right. But yeah, so again, please visit our website, call that number that I provided with the extension so that you can get connected. I also want to emphasize that one of the challenges that we have had, an opportunity and a challenge, we've been able to increase our food distribution to homebound elderly. We actually went up to about 1,800 meals a day.
Wow.
In the Bronx. We also provided at least well over 20,000 reassurance calls to our seniors. We're getting ready to have our next flow of interns from the schools of social work. We have Sacred Heart University, Fordham University, Silverman School of Social Work at Hunter College, Lehman College, just to name a few of the institutions that are going to be joining us soon with interns, and they're going to be helping in this endeavor. The challenge is that we have had so many people that have had deaths and it's been interrupted, and that has an emotional toll, because then you're not able to grieve appropriately, and that might cause a certain trauma to individuals, where, my loved one has died, and I have a friend whose husband died in their home. He collapsed. They came, they picked him up, they took him to the morgue, and that was it. They couldn't have an appropriate funeral and invite others to come in. And then the wife was also infected with COVID. I'm thinking that it's time for us to do a Zoom, but focus on wellness and what you can do to really look at how we're dealing with our anxiety, with our fears, with our sadness. Think about how right now it may be very challenging, even for yourselves, when you see someone that you've known for years and now there's a mask and it's like, you can't really hug, you can't really kiss. We're a very touchy type of expressive community. And so those restrictions makes you think of, okay, let me go through my mental checklist of at least 5 things that I have to do differently in order to engage with another human being in the community.
Right. Thank you for sharing that, Dr. Torres. Definitely the uncertainty or the collective anxieties that we all feel from losing someone or possibly infecting someone during this time has kind of like put us, I don't know, like antisocial in an antisocial space. So I also wanted to share RAIN's Socially Distant Hug Initiative and what that is for seniors and caregivers and for anyone really. Is this campaign still open for those who would like to participate, and what is it?
Yes, let me tell you something. That, came up as a result of us really understanding how isolated these individuals are, individuals with disabilities, the older generation, as soon as our centers became closed and, being isolated. I said, how wonderful it would be to just get a little note, right? A little card that says, we're thinking of you. And we've also received drawings from children, and we've made those into postcards. And so they write the message, thinking of you, hope you're doing well, don't think you're alone, little inspirational and reassuring messages that goes out. So we would get those cards here. We would review them, make sure everything is appropriate, secure, and that there's good content that wouldn't jeopardize anybody that's receiving the card, such as advertisement, or not that we would think that anyone would write a nasty message, but we just have to take, safety measures. And then we would actually forward that over to the senior or the individual with a disability and mail it out to them. So we ask that the individual puts a self-addressed stamped envelope and with the postage paid, and then we will customize the address once it gets here so they can get to that senior. This is ongoing, so you can mail them to our main office at 811 Morris Park Avenue. Attention Card Hug Initiative program, and then we will take it from there. But people have called us to let us know how wonderful it was to just receive a note. And it was just because, without any, attachment to it in terms of marketing or anything like that. It was just because we care.
I love that. And it's a small gesture that means a lot to someone who's in isolation still throughout all these months. So thank you for spearheading that. And I hope that our viewers can participate in the Socially Distanced Hug initiative by RAIN. Before we go...
And think about even the coloring books that you have, adult and for children, things that you color. You could rip out that page and you could send it to us, and then we can also forward that completed drawing to someone.
But before we go, just a message for the community to close out, and how to stay connected, donate, and support RAIN Inc. during these times.
Please visit our website, www.raininc.org, and there's a donate button on the top. We are also providing meals to hungry and homeless individuals, and monies that we get actually also help in that program so that we can continue that mission. We're doing about 500 people a day throughout the Bronx. and every little bit helps.
Thank you so much, Dr. Torres, for your time today.
No, you're welcome. I can't believe the time went like really fast.
Folks, you can visit raininc.org to find out more about their home healthcare programs, resources, and more. OpenBxRx will be right back.
Sorrow and solidarity filled the basketball courts located at the Jackson houses in the Melrose section of the South Bronx as people gathered to say their final goodbyes to Brandon Hendricks.
He wasn't in no trouble or none of that. Just a good kid.
Which is why many community members were stunned to hear about his death. Hendricks, just 17, was shot and killed at a friend's birthday party just days after graduating from James Monroe High School. The basketball star was known to be a positive influence, encouraging others, and for having big goals.
It was something about him, like you knew no matter what, he was going to do something great.
The funeral took place at the First Baptist Church in Bronxville, but the gathering at the basketball courts signified Hendricks' love for basketball and his community. Many of his friends, including Raheem Swinton, says that even in death, Brandon is bringing the community together.
Sad to say, but his death brought everybody together. Everybody became a unit for him. Just this one little boy, everybody became together.
This month alone, shootings are up 277% compared to 2019, and the community is calling for people to put the guns down.
Just got to put the guns, get rid of the guns off the street.
Reporting for BronxNet, Darissa White.
Welcome back to OpenBxRx. The Bronx brand, a brand highlighting and showcasing Bronx creativity, has just celebrated 5 years. They've been a resource hub for creatives and Bronxites, not just for dope merch, but cultural and educational posts. Joining us now to share more is Michael Hamlett Jr., co-founder of the Bronx brand. Michael, thank you so much for joining us today.
Thanks so much for having me. I really appreciate it.
Of course. So just for those who are not familiar, can you tell us a little bit about the Bronx brand and your mission?
So the Bronx brand is a platform for to showcase Bronx creativity. We do that through streetwear. We do that through prints, and we have an online and print magazine, as well as podcasts and web series.
Got you. And congrats on your 5-year anniversary. How has the Bronx brand remained true to your mission since 2015?
Thank you so much. We definitely wouldn't be here without the support of the Bronx. We look at the Bronx as the mecca of culture. We firmly believe that. Hip hop culture is global pop culture, and we're the birthplace for it. We also feel like when you're starting a creative career, it's very hard to find resources, to find support, and to just be able to kind of launch that endeavor. So what we wanted to do was kind of build an infrastructure for the creative community in the Bronx. And we do that through covering costs and just making it very easy for people to join our platform. What we also wanted to do was to build this platform so that these creators can become the next Calvin Klein, Swiss Beats, Al Pacino, Stanley Kubrick, people that have really impacted culture and changed industries.
And for you, what does it mean to be a brand through COVID-19 and revolutionary times of civil unrest nationally and here in our borough with all the protests going on?
Yeah, so when the pandemic hit, it's devastating. The Bronx is 85% Black and brown, and we know that COVID disproportionately affects Black and brown people. So for us, during that time, we wanted to focus on what was happening and what's going on, rather than what we're necessarily dealing with. Just because, I feel like we all know somebody that's been affected by the virus. When it comes to the revolution and the movement, we wanted to make sure that we're giving good information to people, kind of showing the link between the 1960s civil rights movement and what's happening now. Kind of like the more that things change, the more they stay the same. And we really need something new and something radical and revolutionary in order to shake things up and to bring about the progress that we all need. So what we want to do is always focus on those things rather than what's happening with us, just because, we're all going through it. And I think the biggest thing is to just show that solidarity and support to our community.
Word, and thank you for that. I feel that through the screen. Every time I scroll through the Bronx brand, I see like photos being shared from other people in the Bronx on your page, pictures of protests happening, educational information, including the voting information, which I thought was very helpful for us. So thank you for that. You know, that means a lot for a brand to be represented and representing the community in that way.
Yeah, when it comes to the voting guide, a lot of the information is out there, but it's not in a central place. And we feel like that's kind of done on purpose so that people don't have access to the information or aren't able to find it very easily. And what we wanted to do was kind of do the big legwork of bringing all these things together so people can say, hey, let's make an informed decision about our candidates. And also we wanted just to make sure that people kind of are aware of what's happening, what's going on. I think that sometimes the lack of transparency or misinformation is kind of used as a tool of suppression of our people so that we can't necessarily make the progress and change that is necessary.
Thanks for sharing that, Michael. How has the pandemic affected your work, and has the brick and mortar shop at 37 Bruckner remained closed through the pandemic?
So yes, the pandemic has affected us. The brick and mortar shop is closed right now. What we're in the process of moving, just because, you know, when the pandemic hit, it was a little scary. We are a clothing brand and people usually wear clothes outside and you're not gonna buy clothes to go to your living room. But we are appreciative of the support that we have received in spite of that. And we had to kind of switch gears. We started making masks and just things like that, just in order to kind of, you know, continue to operate. But yeah, right now the brick and mortar shop is closed. We are looking to move and to kind of really think through how to, you know, face what's next. But our online shop is open and we do have an app for people if they want to continue to support us.
Right. I wanted to emphasize that the we is just you, your wife Tiara, and your baby P, right? So you're all.
Yeah, it's not a big we. It's a very small we. This is a very, very mom and pop, literally mom and pop shop. Very family business. My wife is the one who made the voter guide. She did a lot of the legwork in finding information and designing it. She's a beast. Penelope did not help in any of those things running around. But yeah, so it's between my wife designing a lot of the things and us thinking through what's next. I'm actually physically printing and physically making sure that everything goes out and shipped. And Penelope is our manager. So
I love that. I love that it's family owned and operated and all just kind of just from this grassroots level. Just, you know, you working at home, creating these masks. I saw videos of you sewing and making the masks, which I also wanted to bring up. Bronx brand also has Bronx branded masks, if anybody's interested. So I wanted to discuss your merch, being a small business and, you know, you do everything in-house and made to order. Do you have any current or upcoming pieces? And as well as I wanted to learn also about the Bronx Brand magazine. You have a second version coming out, I'm sure. The last one came out last year in the beginning of January.
Yes.
Just wanted to learn a little bit more about that.
Yes. So when it comes to the streetwear, yeah, we make everything in-house. Over the last 5 years, the big thing was trying to get all the equipment in order to do everything in-house. I strongly believe that if you control the means of production, then no matter what happens, you're able to produce whatever you create. And also, when we're making these collaborations with different artists from the Bronx, we wanted to make sure that our costs were as low as possible, just because we do revenue splits with our collaborators. So we want to make sure that we offer them enough money when we sell these items, and also we wanted to make sure that our pieces are still affordable and accessible for our community. When it comes to the magazine, we are, yes, we're definitely working on a second magazine. The first one came out the top of the year. And yeah, we're just reaching out to different creatives, trying to find a new way to support the creative community.
Right. And Michael, when you brought up art collaborators, I just want to emphasize on that and learn more about it in case someone's viewing that wants to work with the Bronx Brand. What exactly is the collaboration and how does the Bronx Brand work with creatives in the Bronx to collaborate?
Yeah, so first and foremost, we always ask what neighborhood are you from? in the Bronx, because we want to make sure that we're working with people from the Bronx and have Bronx roots. That's vitally important. So what we do is we'll either think through a design together, or sometimes artists will approach us with the design, and we'll see whether it works on the platform based on what we already have. What we want to focus on is Bronx culture primarily, and also New York City culture as a whole, because that's what really resonates with everybody. And then from there, we send a W-9. And we do a revenue split for t-shirts. It's $12 split. For sweatshirts, it's a $15 split. For hoodies, it's a $20 split for the artist. We cover all the costs, so they're not coming out of pocket at all. Yeah, we go from there. We ship it, distribute it, we're marketing it, and trying to get their feet wet as they're trying to launch their career.
That sounds dope. Thank you, for spearheading that initiative. What's next for the Bronx brand, and how can people support you and stay connected with the Bronx brand as well as collaborate with you?
So we're gonna just continue to build on the foundation that we kind of laid these last 5 years. I see creativity as a very broad, all-encompassing thing. So we want to continue to figure out other ways in which we can support the creative community. And we're going into custom printing. So we have this in-house print shop, and we don't just want to print things that just go on our platform in our brand, but we want to offer it to other creators so they can start their own brand and their own careers. That way they're able to, just build, not just have us behind it, but also have them have their own thing that they own,
Sounds dope. So just to stay connected, how can people connect with you and contact you?
So on all social media, it's at the Bronx brand. We also have an app. You search in Google Play and in the App Store for the Bronx brand, and we'll pop up. That's pretty much it. I don't know what else.
I think that covers it. Thank you so much, Michael, for your time. And again, congratulations to you and Tiara for 5 years working with the Bronx brand and, creating this incredible brand for our borough. And thank you.
No, thank you. I really appreciate it. Much love and respect to you, Sonyi, and to BronxNet.
For sure. So folks, again, to stay connected, you can follow at The Bronx Brand on Instagram and visit thebronxbrand.com to support, shop, and learn more. That's all for our show today. Thank you for tuning in to BXRx. I'm your host, Sonyi Lopez, wishing you and your family safety and wellness now and always. Until next time.